Hello everyone, welcome to our new podcast. In this video, we are going to learn about the Community Health Nursing 2. This is a subject for third year GNM. In this video, we are going to know about the basic concepts of Community Health Nursing. Hope you guys are preparing for third year GNM 2024 examination. For that, this video will be very helpful. So, shall we begin? See, whenever we are going to study for any examination, for any subject, first we need to clear the basic concepts of that particular subject. That is very initial step. So, the thing is, we are going to know so many things by the end of the session. The first thing we are going to know about the subject review, syllabus review, question paper pattern, and the meanwhile important questions and answer writing tips for your examination. Meanwhile, you are going to study about the programs, what and all the health programs rendered by our government of India. These kind of things you have to know. And meanwhile, you are going to know about the problems faced in the community. Okay, what are the health problems faced by the community people? That and all the things you are going to study in this particular subject. This is all about the subject review of the Community Health Nursing 2 in third year GNM. Now we can move towards the syllabus review. Okay, from each and every unit we are going to see. The first unit is health system in India. In this, what and all the things we are going to study means, we are going to study the organization of health system in India and union ministry and central level of healthcare and state level of healthcare, state health administration, state health minister and state health directorate. And when it comes to state health directorate, under that we are going to know about the district level, subdivision, tahsils and municipalities and corporations or panchayats. So these are all the things we are going to see by first unit itself. Okay, the first unit is health system in India. In that we are going to see the how the health system rendering in India. Okay, in the various, by this unit the student will gain the knowledge regarding the health system in India. When it comes to the health system in India, the organization and administration of health system in India at various level. Suppose you are going to know about the things like rendering the health care services in various level means the central level will be there, then state level will be there. Under the state level we have so many things like district level, tahsils means taluk. And one more thing is we are going to render the healthcare services in the rural level. Okay, these are all the people mainly focusing the healthcare services in India. Okay, according to them we are going to study about this unit. And meanwhile, the thing is we are going to know about, by this unit the student will gain the knowledge regarding the health system in India. In that mainly we are going to focus on the organization and administration of health system in India at various level, which means the central level and the state level. Under the state level we have subdivisions like taluk, district level and the rural level and corporation level. These kind of things we are going to study briefly. By according to your examination, what and all the things you are mainly focusing means in this unit you are going to know about the levels of healthcare system in India. In that also whola comes, okay, which means the directorate. Okay, their position you have to know. When you are going to write in the examination, if any question they are asking from this unit, you just to focus on the flow charts. Okay, whatever the things they will ask also regarding the organization and administration of health system in India, use some flow charts and write the answer. That will be effectively to score better marks by this unit. The next unit is healthcare delivery system. In this unit, the healthcare concept and trends, and in rural level how the healthcare delivery will be there, and the next thing is in urban level how the healthcare system and how the healthcare delivery system will be there, and how the facilities they will get, what kind of facilities they will get. And we are going to study about the indigenous system of medicine like Unani, yoga, Siddha and homeopathy. Various kinds of medicine will be available in India. So those kind of indigenous system of medicine we are going to study by this unit. In this unit, I think they are going to focus more mainly on 2 marks questions like indigenous system of healthcare delivery, that you can able to answer like homeopathy, Siddhic and yoga and Unani. Okay, these are all the indigenous system of healthcare delivery. And meanwhile, you are going to study about the voluntary health services, national health programs and the role of nurse in healthcare services. Better you know properly about the role of nurse, especially the role of community health nurse. This will help you to score better marks in the examination. Whatever they will ask also at last of the question, if you are going to write, if you get any space, you just go and write the role of community health nurse. Okay, if they are asking particularly the role of nurse in this particular program, the role of nurse in the particular services, you just mention and highlight the particular role of nurse in the particular program. Like that you use your knowledge and write the answer in the examination. That will make you to score a better marks in the examination. The next unit is health planning in India. This is very important unit. Must and should one question will be they are going to ask in the examination regarding the 5-year plan and regarding the committees. Everything will be included in this unit. Must and should, you have to focus on this unit and you have to study better in this unit, and you should focus on the 5-year plan as well as committees. The 4th unit is the specialized health services in the community and the role of nurse. This is the 4th unit you are going to study in the 3rd year GNM. In this, what and all the things you have to focus means some programs. Okay, some programs and scheme and services will be present in our community health nursing. So that and all the things like RCH means reproductive and child health, then Janani Suraksha Yojan, then ambulance services will be present in the community, and the thing is rehabilitation services will be rendered in the community. That things you are going to study in this unit. These are all the schemes will given by the government of India. That and all the things you are going to study by this unit. In this unit you are going to focus on the Janani Suraksha Yojana and what and all the benefits will get by the patients, and the meanwhile the things what and all the special services they are going to render to the community people like special ambulance services. That kind of things you are going to study by this unit. And the next unit is 5th unit, that is national health problems. Okay, mainly in this unit, this is also one of the very important unit. In this unit you are going to study about the problems will be present in the community. Okay, the problems which are present in the community, that things you are going to study by this unit. In that also they are specified the national health problems. Okay, that is the 5th unit. In this unit you are going to study about the problems which will be present in our India, which means the mainly the thing is the health problems. Okay, like communicable diseases, non-communicable diseases, these are all the things we are going to study by this unit. Okay, in the nutritional problems and how to solve the problem. Okay, what and all the solutions, what and all the schemes to eradicate the problems in India given by the government. That and all the things we are going to study by this unit. The next unit is National Health Program. In this National Health Program, mainly we are going to study about the programs which will be created by our government of India, like the National ARI program, Acute Respiratory Infection program, then revised National Tuberculosis Control program, then National Anti-Malaria program, National Filaria Control program, National Guinea Worm Eradication program. For each and every disease condition, they are going to created one program. Okay, under that they are going to give a proper services to the people to overcome from that particular disease, and meanwhile they are going to reach the need of the people. Okay, for that the government of India has planned so many programs. Under that the healthcare workers, they are going to work. Okay, this is the thing we are going to study in this particular unit. Each and every programs also very important. In this particular unit you have to focus all the programs, and they will going to ask for a long answer questions, and meanwhile we need to write in a particular form. First we need to explain regarding the program, what this program, then objectives, general objectives of the particular program, and meanwhile what is the drawback of this particular, whether it is implemented or whether it is again upgraded, any upgraded roles, what are the roles and responsibility of a nurse in the particular program. These are all the things we are going to study by this 6th unit. Okay, the next unit is demography and family welfare. This is the 7th unit you are going to study in the 3rd year GNM Community Health Nursing 2. By this unit we are going to study about the demographic data, which means regarding the people. Okay, the birth rate, death rate, everything, mortality, morbidity, we are going to study by this unit, and the trends in the world and in India, and also we are going to include the family planning norms and the methods of family planning. What are the main essential role of community health nurse in the family planning? This is one of the very important topic. You can able to expect 2 marks, 1 marks question from this unit, and meanwhile 3 marks question also. You have to focus on the family planning and the methods of family planning, and what are the roles and responsibility of the family planning. Whether they are asking about the family planning, you have to focus on these aspects in the particular question. Like family planning, you have to tell about the family planning methods in a broad chart. Okay, you should not write simply. Okay, you should use some charts while writing this kind of things, or you are going to explain any classification, or you are going to explain any particular levels. You use the charts as a schematic representation. While answer writing, you have to use this tip, and the thing is you have to briefly explain regarding the family planning. The meanwhile you are going to know about the vital statistics. The next unit is 8th unit, that is health team. Okay, in this unit you are going to mainly know about the concept, composition, and how the health team will be formed, and who are present in the health team, and how they are going to render the service for the people in the community sector, and whether it will be in the PHC, what and all the roles and responsibility of each and everyone which will be present in the health team. These are all the things we are going to know in this unit. This is also one of the very important unit. Here also you can use the charts while writing the health team members. Particularly they will ask this question only every time. If you go and see in the previous year question paper, you can able to know that so many times they are asking about this health team members. Okay, just study this question, and this is one of the important topic in the health team, and the concept and the composition, then positions, everything you are going to study by this unit. This is one of the very, very important unit, and the meanwhile you have to focus on the things like roles and responsibility of the each and every member which will be present in the health team. This is also one of the very important topic in the community health nursing too. And in this particular unit they are mainly focusing on the functions of the each and every one. Okay, which means the functions of the health team members and roles of the health team members, both are same only, but you have to write more regarding this health team members and their functions. Okay, this is also one of the very important topic. The next unit is Health Information System. In this unit, mainly you are going to focus on the concepts, components, and uses, sources. The main important topic of the unit is vital statistics. In this, you are going to know about the important rates and indicators, then vital health records and their uses. Vital statistics means you are going to know about the data regarding the death, birth, marriage, everything you are going to collect. Okay, that is the thing you are going to study by this unit. And by this unit you can able to expect the question regarding the topic of vital statistic. That is one of the important topic in this unit. Just focus on that unit, study well and refer the previous year question paper and you will get the good marks in the examination. The next thing is the 10th unit. In the community health nursing, in the 10th unit you can able to know about the health agencies. Okay, this is also one of the very important. You have to know about the health agencies, which will be national health agencies and international health agencies. You are going to know in this unit, like WHO, UNFPA, UNICEF. Okay, these kind of things you are going to study by this unit. WHO means what? World Health Organization. UNFPA means United Nations Population Fund. UNDP. So these are all the things we are going to study by this unit, health agencies. Okay, this is the thing we are going to study by this unit, like regarding the agencies, which means Red Cross Society, World Bank. Then we are going to study about the WHO. You are going to study about the UNICEF, UNDP. These are all the things mainly we are going to focus by this unit. Okay, this is also one of the very important unit. You are going to study each and every health agency is very important. Okay, by now we have discussed about the syllabus of the community health nursing 2 for GNM third year. Okay, now we can move towards the next part, that is what previous year question paper. In this previous year question paper we should know first thing is the question paper pattern. Okay, that will be very helpful to know the question paper pattern. That is what previous year question paper. Okay, by studying the previous year question paper, make sure you will score better in the examination. Okay, that is the key of success for your good marks. Okay, for that purpose you have to focus on the previous year question paper. In this video we are going to discuss about the 2021 April community health nursing 2 question paper. Okay, for wherever you will go, whatever exam you are going to attend, the first thing is that you have to know about the examination pattern briefly. Okay, for that purpose we are going to discuss the examination pattern here. Okay, this will very helpful to you to get a good marks in your examination. The first thing is that you are going to write this community health nursing 2 examination for 75 marks. Okay, in this you are going to attend the first main, give the meaning of the following. Okay, you are going to write a meaning of the particular term. Okay, that is the first main of your question paper. Each question carries 1 mark. See, here is the tip to tackle this main. Only the thing is, it is very easy to answer. Okay, they are going to ask about the particular terminology meaning. Okay, in this question paper they are going to ask about the silicosis, and meanwhile they are going to ask about the eradication meaning and yoga, and one more is mortality rate. The next thing is that first main is give the meaning of the following. Okay, here we have 4 questions. Each question carries 1 marks. Okay, the first question is silicosis. The next question is that eradication. The next question is infant mortality rate. The last one is yoga. Okay, for these questions you have to write the meaning. Okay, in this question how you are going to write means, only the thing is you are going to write the meaning. Everyone know that. Okay, in that also for certain definitions we need to write, and we need to underline, and we need to specify the things with the inverted comma. Okay, then only the invigilator will going to then only the evaluator will going to see your answer, and that will be very attractive the evaluator. Okay, if you are not right in a proper way, if you write a correct also, the evaluator will never see. Okay, better you write in a good handwriting, better make sure if any specified point underline the things. Okay, right, like that use some tips in this particular main. Okay, the first main is clear, no? Give the meaning of the following. Here we have a 4 question, each question carries 1 marks. Okay, you can score 4 marks in this main. The next main is that true or false. Okay, some statements, here you can see that some statements they have given, and we need to write only whether it is a true or false. Okay, if it is a true statement, you need to write a true. If it is a false statement, you need to write a false. Okay, you have to study nicely in this main, then only you can able to attend the questions. Okay, the next part is, in this part only the 4 question will be there, and here we are going to get a 4 marks. Okay, which means the each question carries only 1 mark. Next main is write a short notes. Okay, answer any 4 of the following. Here we have a 5 questions. Okay, but only the thing is we need to answer only 4 questions out of 5 questions. Okay, this one is clear, no? Then the next thing is each question carries 3 marks. Okay, here we can able to score 12 marks in this particular main. Okay, here they are going to ask about the state health administration system of India. Okay, that is the thing they are going to ask, like that kind of things, or they are going to ask about any particular committee like Kartar Singh committee. Sorry. From this main I will take. The next main is that write a short notes for the following. Write a short notes for the following 4 out of, once again. The next main is that write the short notes for the following. Okay, in this main we have mainly 5 questions. Out of 5 questions, mainly we need to answer only for the 4 questions. Okay, in this main each question carries 3 marks. Here we are going to score 12 marks. Okay, in this main we can able to score 12 marks in this particular main. Only the thing is we are going to write the short notes regarding a particular topic. In this question they are going to ask about the health system, the health administration system in India. Okay, the next thing they are going to ask about the committee, and the next thing they are going to ask about the national diabetes control program. Okay, for that kind of things we need to ask. Only the tip to answer writing is use some proper bullets, which means point wise you write, or use some proper schematic representation while writing the short note, and highlight the heading. These are all the tips. If you follow, you will get a better marks. Okay, if you write answer, I know you people are study well, you are going to write in a good way also, but the thing is if you are not at all underlining anywhere, you are not at all highlighting the point, you will lose the marks. Okay, for that purpose you should underline and highlight the point. Whether you want to use the bullet, use there, and meanwhile if you want to use any specific points, use some schematic representations. Okay, like that if you use means you will get a good marks. And study the topics nicely and elaborate the answer in a particular neat and disciplined way. The next main is answer the following. Okay, here we have some splits. Okay, 14 and 15 question will carry 3 plus 5 marks. Okay, total we are going to get 8 marks in this 14 and 15 question. The next thing is 16, 17, 18. From that question again we have a split. The first question carries 2 marks, the second question carries 3 marks, then the third question carries 5 marks, total 10 marks. Here we are going to get 18 marks from those 2 parts. Okay, the 14, 15 will carry 3 plus 5, then 16, 17, 18 will carry 2 plus 3 plus 5. Okay, this is the things we are going to get the marks. This is, you just understand properly this main. And meanwhile here they are asking about the list the family planning methods. Okay, when it comes to the family planning methods, how you are going to attend this particular question means use some proper charts. Okay, in the when it comes to the family planning method, no, first you give some definition. Okay, particular definition you write. If you know about any author is given that a definition properly means you just write downside according to this author. Okay, the next thing is you just move towards what the question they actually ask. Okay, here they are asking about the family planning method, yes or no. For that family planning method, use some tables. Okay, here you can write permanent family planning method, and here you can write temporary family method. The next thing is they are asking about the scalpel vasectomy method. Okay, that the next question, which means the 15th question, they are asking about this question. You can explain briefly about the scalpel vasectomy. Okay. The next is 16, 17, 18. In this 16, 17, 18, they are asking about the health information system. In the first 16th question, they are going to ask about the defined health information system. Yes or no? The next thing, they are going to ask about the components, and the next one, they are going to ask about the sources. Okay, each and every question you are going to attend, keep in your mind. The thing is that first you mention the question number properly. Okay. The next thing is highlight the headings. While attending this question, you just highlight the headings. First one is definition. Definition, you just in top of the definition, before the definition, you just write the health information system. Then you put one small side heading, that definition. Then you write the definition, and then you have to write according to whom, means who said this definition. If you know means you just mention there, otherwise you can leave. And the next thing is you go and attend the next question, that is about the components of health information system. The next thing is the source. Okay, like that, in one by one, in a neat and disciplined manner, you attend the question. Okay, you can score 10 marks by this question. The next main is fill in the blanks. Everyone know about the fill in the blanks. They will give some particular point and you are going to write, or you are going to fill the particular blank. Okay, that is what fill in the blank with the appropriate suitable answer. Okay, that is what the fill in the blanks. Here we have 4 questions. Each question carries 1 mark. Here you can able to score 4 marks by this main. The next main is that write a short note for any 3 of the following. See, in this particular main we have 4 questions. Okay, but actually we are going to answer only for a 3. Okay, why? They only mention that only you are going only answer for 3 questions. Okay, for that purpose we are going to answer for 3. And the next thing is each question carries 5 marks. In this particular main you can able to score 15 marks. In this particular paper they are asking about the rehabilitation. Okay, in that also role of nurse in the rehabilitation. Rehabilitation means what? Bring back. Okay, the word you should remember, that rehabilitation means bring back. In that rehabilitation, what is the role of nurse? Okay, whenever you are going to write the role of nurse, use some schematic representation. Don't point it out. Okay, use some schematic representation, use some charts and all, or in draw one flower. In that flower you write the role of nurse. It will be attracting the evaluator. Okay, and try to use some bigger font, which means just use a bigger size of your handwriting. Okay, otherwise if you write in very small handwriting, it will be not able to see by the evaluator. By that time what will happen, if you write a correct answer also, you will not score a better marks. For that purpose you just use some bigger size of your handwriting, or you increase your font size. Okay, the next thing is here also they are asking about the fertility and infertility and the role of nurse in a healthcare services. Like that kind of questions only they are asking, and asking about the program also, iodine deficiency program. Okay, whenever we are writing the program, just write the introduction of the program, when it was started, highlight that year, and the next thing is you go to the objectives, general objectives of that, and what are the implementation, what are the services given to the community people. These are all the things you should mention, and who are taking the benefits from this particular point, highlight these points. You will definitely score a better marks in this main. The last main of the question paper is that answer the following. Okay, in the answer the following we have that 3 plus 5. Okay, we have 2 questions. First 2 questions that will score 3 plus 5, that will be 8. Total marks is 8 allotted for these 2 questions. Okay. The next 2 questions we have 5, 5. Okay. They are going to split the marks for one question 5 and the next question 5. Total we are going to get the 10 marks. Here you can see that the first 2, 27, 28, here they are going to tell that split the marks like 3 plus 5, total 8. The next thing is 28, 29, sorry. The next thing is 29, 30, that is what? 5 plus 5, here you can score the 10 marks. Understood? The next thing is how to write this long answer. Okay, when it comes to the answer the following, here we are going to answer particular questions for a more marks, yes or no, 8 marks and 10 marks. Here you need to use some proper skill. Okay, proper writing skill will be there. Okay, whatever the question will ask also, you just start by the introduction, definition and the actual what they ask. Okay, like that if you start means, and end the question with a small conclusion. This will make sure you to help to score a better marks in this particular examination. For example, they are asking about the what is the composition of the health team. Okay, when it comes to this particular question, they are asking for the 3 marks. For 3 marks, how much you are going to write the answer? First you plan. Okay, time management is also very important. For that purpose, you should always know what to write, what should not to write. Okay, what to avoid, what to write, you have to plan before only. Okay, when you are going to write the examination. Okay, here they are asking about the composition of the health team members. Okay, you can explain in a proper way, which means you can use some charts. Okay, in the charts from first who will come, the next who will come, like that you are going to explain. Means you can nicely explain this question. Then after 1 or 2 points, you just add the roles and responsibility of the particular team member. Okay, that will make sure you to help to score a better marks in this particular question. Okay, like this we are going to attempt the long answers, means 5 marks and 10 marks questions. We can able to get a good marks in this particular main. This is all about the previous year question paper. In this previous year question paper, we have seen the mainly we are focusing on the examination pattern. Okay, we have meaning, we need to write the meaning of the following, like that kind of questions. Each question carries 1 marks. The next thing is we have true or false, that is also 1 mark, and we have the short notes. Okay, sorry, short notes. We have short notes. In that short notes we are going to score 3 marks. Okay, for 3 marks and all we are going to write the short notes in the particular main, and we have a fill in the blanks type of questions, answer the following, like this kind of questions we have in this particular previous year question paper. According to this pattern, if you are going to study and you are going to know the examination pattern, everything and the syllabus, you will get a good marks in the upcoming examination. Here we had discussed about the previous year question paper pattern, and previously we discussed about the subject review, the mode of examination, passing marks, each and everything we had discussed in this session. So if you want more exam preparation video like this only, you just go and check in the description box. The links are available in the description box. By now we had discussed about the syllabus review, subject review, mode of examination, and the meanwhile we had discussed about the previous year question paper also. Okay, this much will help you to get a better marks or tackle the examination for upcoming 2024 December GNM exam. The nursing exams are very near. Students, don't waste your time. If you are facing any kind of difficulties while studying the nursing topics, here we have some exam preparation videos in our Nursing Guru applications. If you want such kind of videos to prepare and boost your knowledge in the nursing, you just go and check in the description box and watch it